Hello, everyone. This is Dr. Antonio Jimenez coming to you from Hope for Cancer Treatment Centers in Mexico. I'd like to thank Dr. Nui, the SSRI Clinic, for this international conference. Today's topic is the connection between the immune system, aging, and cancer. It's a very special topic that I'm presenting today because in our clinical experience and information from colleagues all over the world, we're having a higher incidence of cancer. We're seeing younger patients with cancer. And we know that this is not getting any better because also patients that were in remission are coming out of remission. So let's look at the connection between the immune system and cancer and also how that is related to aging. Here we see that Hope for Cancer Treatment Centers has two facilities, one in Tijuana, Mexico, and the other one in Cancun. Both treatment centers offer similar protocols, the same protocols, but they're always individualized and personalized. We have over 600 new patients every year, cancer patients, and patients from over 40 countries, and a staff of over 25 medical doctors in our facility. We all begin with the biological terrain that looks like this: healthy, pristine, clean, fresh air. And as we go through life and with age and neglect, it starts to look like this. It becomes contaminated, it becomes toxic, there's negative thoughts, and this results with the outcome of or onset of chronic diseases, and one of them is, of course, cancer. So a lot has to do with that terrain. So how we address this at Hope for Cancer is through the 7 key principles of cancer therapy, which is actually the topic of my first book, Hope for Cancer. 7 principles to remove fear and empower your healing journey. We are proud to say that the 7 key principles were first published in a peer-reviewed journal out of UCLA in the year 2012. So let's look at these 7 key principles. And what I want you to do as you see these 7 key principles is analyze yourself, analyze your patients. What can they do better with these 7 key principles? The first one is non-toxic cancer therapies. The second one is immunomodulation. Third is full spectrum nutrition. Fourth is detoxification. Fifth is oxygenation. The sixth one is restoring the microbiome. And this one, I'd like to pause for a second and explain that typically we think of only the gut microbiome. We heard of the gut-brain connection. And I believe it's the gut-everything connection. And so when we talk about restoring the microbiome, we're focusing on the gut, but we cannot forget the oral or dental microbiome, the emotional microbiome, the skin microbiome, and so forth. So it encompasses the different ecosystems in our body as reflected by that area of microbiome activity. And the 7 key principles, which I think is the most important one, is emotional and spiritual therapy or healing. Conventional medical wisdom says treat the tumor. It's all about focusing on the tumor, whether it's with surgery, chemotherapy, radiation, immunotherapy, or gene-targeted therapy. What we do in integrative oncology is that we treat the person with the tumor, not the tumor in the person. And so when we treat the person with the tumor, we're not just focusing on the tumor itself, we're also focusing on the quality of life of the individual patient. We're focusing on their emotional health, how are they feeling. So it's a lot to do, obviously, with the person as a whole and not the person as just one with the tumor. There's something that we say that cancers are smart, they're not stupid. So is our therapeutic strategy, is the treatment that you are applying for your patients enough to outsmart the cancer? That's a question that we all should consider with each and every one of our patients. Because we know that smart cancers, which are 90+% of all cancers are smart cancers, we know that they harbor genetic mutations. And in this graph that was published in the peer-reviewed journal Nature in 2013, we see that the top five cancers uh, with mutations are lung cancer, colorectal cancer, ovarian, glioblastoma multiforme, which is the brain tumors, and also prostate cancer. So you have lung, colorectal, brain, ovarian, and prostate. These are the cancer types that harbor the most genetic mutations, therefore making these cancers more difficult and more challenging to treat. Of course, this is a generalization because there are, not a generalization necessarily, but there are other, as you see here, stomach cancer, esophagus cancer, melanoma, also some forms of breast cancer that have a strong genetic mutational load. And let me give you an example of that. Here is a precancerous cell, genetically unstable, and as that cell grows and there is mutational triggers, that cell begins to divide, and then it develops further mutations. And you see here that there's new clone cells, clonal expansion, this is called, that gives the tumor, the developing tumor, the survival advantage. And ultimately, by the time there's advanced tumor load, you see that the initial tumor cells on the right are quite dissimilar, heterogeneous to the original tumor. So as you see all the blue on the left in the original tumor, by the time there's mutational diversion and this tumor has grown and possibly metastasized, there's quite dissimilar. Now we have blue, red, orange, green, pink. And in this slide, in the next slide, you will see that a tumor that starts in the lung, let's say, and by the time this tumor is growing or developing, as they evolve over time, it's becoming more complex and difficult to target because of this clonal mutation. And as it metastasizes, as you see here, there's more genomic chaos. The genetic diversity further multiplies when cancer spreads or metastasizes. So in this example, the cancer that started in the lung now has metastasized to the brain and to the liver, looks quite dissimilar to the original lung tumor. This is why when you have chemotherapy, you have certain tumors, locations, like maybe the lymph nodes disappeared or the liver metastasis reduced, but the breast tumor continued to grow. Or the breast tumor slowed down, it disappeared, but there appeared now growth in lung metastasis or liver metastasis. Why is this so? It's the same chemo that is being given to attack all the different cells, but we know that because of this genetic chaos and diversity of cell type, then the chemo is not effective in all of the cancer cells. And this is why also that they give you 2, 3 different types of chemo at the same time. So from a match, we start a slow fire, and then there is a wildfire. And we have quite a challenge to stop this tumor progression and growth. And We know that 99% of a tumor is non-cancer stem cells, and about 1% are cancer stem cells. And in these cancer stem cells, these are also called, when they leave the primary tumor and they go to the bloodstream, they're called circulating tumor cells. And we know that circulating tumor cells mostly do not survive. If we take into consideration that a primary tumor that's 1 cubic centimeter in diameter has 1 billion cancer cells, that's billion with a B, as in boy, and it releases 1 million cancer cells a day into the bloodstream, most of which are eliminated by the immune system, but some do escape and develop into new metastatic niches or potential. So about 0.01% of these billion cancer cells per day, which is about 100 cancer cells per day, have metastatic potential. So we really need to have an optimal immune system that can recognize these cancer cells in order for these circulating tumor cells not to form metastasis at a distant organ, of course, and stop the progression of disease. And this is largely contributed to having an optimal immune system that can recognize the cancer cells. So here was a study that was done at the University of Iowa, and this was published back in 2015 in the American Journal of Cancer Research. So what they found is that, as you see on the left, there is a cancer cell. On the right, there is a normal cell. So what they found is that cancer cells, malignant cells, release like a rope, like a lasso, that will be excreted or secreted or given off by the tumor cell to grab onto the normal cell and further its growth. So you'll see here in the video that shows how cancer cells hijack healthy stromal cells to grow into a larger tumor. Look at that where the arrow is. So this is one of the mechanisms of cancer cells and how they can lasso in neighboring healthy cells. Quite a smart process. So cancer is not a stupid process that it just happens by random. I believe that cancer is an opportunistic disease, and the difference between stupid cancers and smart cancers, remember, 90+% of all cancers are smart cancers, and they have multiple driver mutations. They have large mutational load. Multi-targeted therapy is needed to have a successful result. And resistance is common and develops early and cannot be treated with same or similar medications. We know that cancer cells mutate very quickly, and sometimes we say, oh, the patient is fine, they're in remission, come back in 3 months or 6 months and go and eat whatever you want. The chemo did its job. But this is where the circulating tumor cells have not been detected by PET scans, CAT scans, MRIs, and this is a risk. So any of your patients that are in remission must adhere to the 7 key principles, must not have that attitude of wait and see to my next CAT scan or MRI or PET scan. And here's an example of how these driver mutations that are on the surface of cancer cells play a significant role in targeting the mutation individually leads to short-term results. This is a patient with a BRAF mutation. BRAF mutations are common in several types of cancer, including, as you see here, melanoma, colorectal cancers, and others. And so this patient was found to have a BRAF mutation. He was treated with a kinase inhibitor, a RAF inhibitor, This is the picture in the baseline before treatment. And as you see here, look at what happened 15 weeks post-treatment. Great results. Everybody is happy. And by the way, this was published in the Journal of Clinical Oncology in 2011. But we're targeting one mutation. And these smart cancers with genomic chaos and genomic diversity have multiple, many mutations on the cell surface. So at some point, the cancer cells are going to figure it out. They're going to bypass that mutation, and these immune targeted therapies will be ineffective, as happened here. As you see, 23 weeks or 8 weeks after having great results, the cancer cells are there again. And now the cancer, the melanoma bypassed the expected oncogenic pathway with the RAF inhibitor and exhibited significant, I don't even want to call it recurrence, but recurrence at least that we could not only see, but also witness with scans. So the point is that we have to really target our immune system and from multiple sources. And now we'll talk how that immune system and aging is important to prevent the immune system from being asleep, if you will. Immunosenescence is the word. And there is much to be learned from, uh, from my colleagues and the people in Japan about living a long and healthy life because studies have shown, this was published in the European Journal of Clinical Nutrition in 2021, and this shows the life expectancy in men and women in Japan that they live longer than most other developed countries in the world. However, I like to say from my observation and experience that in visiting Japan many times, that more often as I'm going there in the last 5 years, they're developing a Western, as you know very well, a Western, more of a Western lifestyle, specifically with nutrition and fast food restaurants and, Wi-Fi and 5G and all this technology that is hopefully will not decrease life expectancy and quality of life too much in our lovely people and country of Japan. And this was the trends in circulatory diseases. We know that heart disease is the number two killer in the world after cancer. But this shows that people in Japan have the lowest incidence of mortality from ischemic heart disease and their previously high mortality rate from cerebrovascular diseases has been controlled drastically over the years. So a lot to be said of what work is being done in Japan for cerebrovascular and cardiovascular diseases and their mortality. So finally, in this last slide, we see that people in Japan, especially women, enjoy the lowest rates of cancer mortality among developed countries. Something to be proud of, but at the same time, something to be a bit concerned about in the sense that your responsibility and challenge now to your community and your patients is high because we want this to continue for the citizens of Japan to be the lowest rates of cancer mortality and incidence in the world. Today, science is uncovering many factors that contribute to the process of aging. And this was published in 2013 called The Original Hallmarks of Aging. And I don't have enough time to go over each of them, but here you see genomic instability, telomere attrition, epigenetic alterations, loss of the proteostasis, deregulating nutrient sensing, mitochondrial dysfunctions, a big topic in the latest years, and now it's totally linked to aging, cellular senescence, the cell energy, cell integrity, and cell function, stem cell exhaustion, the inability of new stem cells to be grown by the body as damaged and healthy cells become unhealthy cells. And then finally, altered intracellular communication. Remember, each cell is communicating with each other. And more recently, in 2023, this year, they outlined three additional hallmarks of cancer, of aging, I'm sorry. Disable macro autophagy. That means the ability of cells to apoptose once they become damaged and unable to repair themselves. Dysbiosis, we know that a high percentage of our patients have gut dysbiosis, petrification, or fermentation, and ultimately, of course, chronic inflammation, which is associated with increased risk of chronic diseases and shortening of telomeres and speeding up of the aging process. With respect to a balanced immune system, we know that there can be a overactive immune system that leads to autoimmune conditions and allergies. This is truly immune dysregulation with an overactive immune system. On the other side, if we have an underactive immune system, then we are more at risk of infections and, of course, cancer. So in essence, what we want is to have a balanced immune system and have immune regulation as opposed to dysregulation to lower our risk of developing autoimmune diseases, allergies, infections, and cancer. So aging impacts the immune system significantly in different sections and because of different factors, and this results in chronic diseases like cancer. So the fact that the thymus gland involutes as we get older, the fact that there can be ongoing inflammation, T and B lymphocyte dysregulation, which is very important, both the innate and the adaptive immune system is implied here with respect to immunoglobulins, antibodies, CD8, CD4, which are signal molecules that target the immune system to have an attack specifically on cancer cells, bacteria, virus, and pathogens. So the overall changes that can happen with immunosenescence when the immune system is not optimal is that you have a decrease in telomerase activity, increase in tumor incidence or cancer, decrease in infection protection, if you will, and an increase in autoimmune and inflammatory reactions. And this is all can be compounded by decreased response to the immune system secondary to vaccinations. So why does aging make us more susceptible to chronic diseases and infections? A good question nowadays, and a lot has to do with how the thymus deteriorates with age. On the top panels, you see that the thymus, the morphology of the thymus gland, which can also be considered an organ, from the time that a baby is born to someone that's 70 years old, there's very little thymus tissue in that gland. And histologically, on the bottom, you see the pattern where there is an overwhelming amount of adipose tissue in the perivascular space, contrary to glandular tissue, thymus tissue. As we get older and as we have a more depressed or immunosenescent state. And here you see from left to right that the productivity of the thymus also decreases, and the nature of the body's T cell pool changes, meaning that as the thymus gland involutes or gets smaller, it affects the T cell production and the diversity of the T cell pool in the body. So what's important to remember here is, we learn in medical school that by the time we are mature, 18, 19, 20, that's the peak of our thymus activity, and then it becomes to involute. And every decade, we have less and less thymus tissue. So what can we do here? Number one is to make sure that our children are having immune modulator therapy. I definitely recommend even children to start on GC-MAF at an early age, um, and and continue this obviously throughout adulthood. This should be part of your standard, you know, protocol for prevention and maintenance of good health and prevention of chronic disease and cancer, and maintaining an immune system that's awake, optimal, of course, with all the lifestyle implications and following the 7 key principles. So as we age, we know that the thymus is affected, and this lowers the immune barrier. So the lower the T cell production, the, as that decreases, the barrier for pathogens or cancer to escape the immune system is lessened. So we see that there is a increased possibility of growth and of cancer cells, of bacteria, of pathogens that can overwhelm the immune system. As we age, the thymus gland is involuted, and we're not doing too much on a daily basis to maintain our immune status. Immune system goes to sleep, immune senescence, and we get increased inflammation. And this is when we look at all those hallmarks of aging that we saw previously: mitochondrial dysfunction, inflammation, epigenetic changes, and so forth. So you well know that it's important to assess the inflammatory status of your patients doing C-reactive protein. And we know that C-reactive protein is elevated due to infections, obesity, arteriosclerosis, type 2 diabetes, heart disease, allergic reactions, sepsis, and of course, cancer. So C-reactive protein is an indirect indicator of something going on in the body that's not healthy, of course. And I like the C-reactive protein to be below 1 in our cancer patients. High sensitivity C-reactive protein. So we did a small retrospective look at 82 stage 4 cancer patients, and we noticed that 61 of them, which is 74% of these patients, when they were admitted before they started therapies at Hope for Cancer, exhibited CRP values that show mild to excessive inflammation. And as you see here, a great percentage of them were in the 10 and above in C-reactive protein. So very moderate to excessive radiation, with a few of them even above 100 in the C-reactive protein. So it's real. These are real-time values and data from 82 cancer patients. The erosion of the telomeres, as we know, leads to aging. What accelerates the shortening of the telomeres is repeated cell division that happens at age, as we age, DNA damage that's coming to us from environmental toxins and exogenous toxins that we're consuming, inflammation, and then lifestyle, as I said, smoking, nutrition, alcohol, possibly excessive alcohol use, uh, mental stress, and depression. So what we want to do, of course, is figure out what slows down the shortening of the telomeres. And this is increasing telomerase activity, making sure we have a good balance of sex hormones, a healthy lifestyle, physical activity, exercise, lowering stress, and a couple of the therapies that we use for this uh, lengthening of the telomeres is, of course, GCMAF, and that will be covered extensively by Dr. Inouye. And here at Hope for Cancer, in addition to the GCMAF, we have a brilliant product called Durata Vita, which is our new anti-aging or slowing down healthy aging supplement that does a number of things and brings in the support to our immunotherapies, our bioimmunotherapies, like mistletoe, our T cell modulation therapy, Salvis, RNA thymus therapy, our natural killer cell therapy, or SOTA, and of course the MAF, the GC MAF bioimmunotherapy. So now we have all these therapies, including hydrogen therapy, as bioimmunotherapies, and we're bringing in a supplement that will exhibit four main benefits in a healthy aging and strategy. One is that the Ratavita has been shown to regenerate the thymus with the use of lyophilized uh, bovine thymus, DHEA, amino acids, goat's rue, and secondly, it stimulates telomerase activity. We have certain substances in this formula like astragalus and resveratrol. And thirdly, it's a potent uh, enzyme NRF2 that is in this product, activator, that shows uh, antioxidant response through the use of superoxide dismutase, catalase, L-glutathione, rosemary, ginger, and rutin. So we're using some herbals products as well. And lastly, the fourth benefit of Durata Vita in its anti-aging strategy and health strategy, actually I take Durata Vita myself as well, is a lymphocyte organ. These are also cell NR14 activators, which is a blend of 14 lyophilized organs known in naturopathic medicine to restore tissue and organ function, and they're rich in cellular messenger nutrients. Things like heart, lung, brain, pancreas, tissues that will help, as I mentioned, to strengthen those organs and help regenerate those organs. So as we conclude this, we see that anti-aging is not a targeted strategy. It is a holistic endeavor, meaning we're not going to just say, okay, we're working on this part of the immune system, or we're going to attack solely the cancer cells, or let's correct the immune response. It's the holistic approach. I encourage you to follow those 7 key principles. Uh, Teach them to your patients. And in my concluding remarks, aging is inevitable, but its unnatural acceleration can be prevented by taking appropriate measures. Second, the process of aging and immune system health are intricately connected. A deteriorating immune system accelerates aging, while an aging body damages the immune system. Third, restoring the health of the thymus gland is essential to rejuvenate the adaptive immune system, allowing the body to prevent or heal from chronic disease. Remember, cancer is not a death ward. There's always a good possibility that your cancer patients can heal, at least live longer with much better quality of life. Slowing down the erosion of telomeres could put a brake on the aging process. This can be accomplished with targeted nutrition, supplementation, specifically the Durata Vita, and lifestyle changes. So thank you for your time, for your attention. I'd like to point out that these holistic therapies are available in Japan through the Japanese Cancer Control Society. You see the number there, uh, 8135-294-8899. And if you want to know more about the Japanese Cancer Control Society, you could go to their website that's listed there. And also, we have a Japanese translation of my book, Hope for Cancer, Seven Principles to Remove Fear and Empower Your Healing Journey. And the QR code is there where you could order it through Amazon there in Japan. And also, I invite you to join us in our webinars that we have every 2 weeks, are very educational at our website, hopeforcancer.com. And thank you, Dr. Inui, for having me again, Sasai Marai Clinic. One of the first times I met Dr. Inui almost 5 years ago in Japan in 2019, and been to Japan many times in 2022. This is Sensei Moriyama from the Japanese Cancer Control Society. And most recently, Dr. Nui and I met in Romania in September of 2023. And here we are with some top professors, medical professors in Romania, uh, and also practitioners and myself. So again, Dr. Nui, thank you for this conference, international conference on immune health and immune strategies. And it was a pleasure to be with you. Arigato gozaimasu.